Hello. Okay, so I'm going live with Dr. Jen Zilovitsky, and I'm so excited. I'm going to invite her in, and we're going to talk about um, alcohol and the impact of menopause. And I know that this is, there you are. Oh my gosh,
We
that's the
did
best.
it. We
Yay.
did it. Yay. We did it.
Yes.
Hi.
Hi, how are you?
I'm doing well. How are you? We had a little bit of technical difficulties getting this going today. I don't know. It's something in the air.
Yeah.
It's a holiday Monday. We had holiday Monday vibes.
Yeah,
But I'm glad
exactly.
we're here. I'm glad we're doing this.
Me too, me too. So, okay, we're going to talk about menopause and alcohol. And I know I saw your stories. Hello, Wendy, welcome. Um, so we'll talk through some of the impacts of alcohol and menopause, but or perimenopause as
Mm.
well. And I want to let's tell everybody who you are and what do you do?
So I'm Jennifer Zelovitsky. I'm a certified menopause practitioner. I'm a physician. I'm in Canada, Toronto, Canada, and I see women in perimenopause, menopause. I help them with, hormonal therapy, non-hormonal. We talk about lifestyle a whole lot because that is such a big part of managing the menopause transition.
Yeah.
And so we have a lot of overlap in our work because I think so many women, there's an intersection between the use of alcohol and also the kind of withdrawing or stopping the use of alcohol when women go through the menopause transition. It's kind of funny. Some women sort of decide they need to stop, but others decide they need to lean into it. So
Yeah.
it's interesting to understand that the crossroads where perimenopause and alcohol meets, which is what
Yeah.
brought you and I together.
Yes, yes. And if you're just tuning in, we have a podcast episode with our full interview coming out this Wednesday. So I will be sharing that and we'll share that on social media and email. So I'm super excited for that to come out. I can't wait to re listen to it because it's been quite a while now since we
Yeah,
recorded
it's
it.
true.
So, what would you say is like the top negative effect that alcohol can play on some of the symptoms from perimenopause?
I would say the number one that I hear is sleep.
Hmm.
Most women discover on their own that alcohol interrupts their sleep because it's one of those tricky things. It's a depressant, so meaning it calms you down initially, but it disrupts the architecture of your sleep. So what you end up having is a shallower sleep, a more disrupted sleep. And for some women, that's because it also increases their hot flashes, their night sweats. So that temperature dysregulation gets worse. So I often have women tell me, I'll say, oh, I can see on the intake interview you mentioned you're having like 5 glasses of wine a week. And they'll say, well, actually, I've already cut that back because I noticed on my own that it was really a big trigger for me and it was a clear pattern for them that on those nights that they would go out and they would have those drinks, their sleep would be even worse. So there's a lot of self-regulation that goes on, but others don't have those profound effects. So it's much more subtle, and so they don't realize the effect that it's having on their sleep.
Yeah, I often say that alcohol helps you fall asleep, but then it kind of ends. There's a difference between falling asleep and passing out or kind of sedating yourself through alcohol.
Totally. And it's a false, sense of security because you're like, I'm sleeping, but you're not. You're not waking up feeling any better. You're actually feeling a little bit worse. And there's also a two-way direction between depression and alcohol use, right? Alcohol use makes depression worse, but then depression can also increase your use of alcohol. So
Yeah.
it's an interesting um, cycle that you can get yourself stuck in.
Yeah, many. So my personal experience with that is after I was on various antidepressant medication for most of my adult life, like shortly after college and then into my late 30s and even 40. And then about 6 months after I quit drinking, I went off. I didn't require it anymore. I just don't
Mm,
take it. And many of the women who I work with, they report that when they reach that like 6 or 8 month alcohol free time frame, it's time to really evaluate with your doctor if you really need it.
that's so true. That's really interesting. And look, it's not to say that antidepressants are a bad thing. I mean, they're getting a bit of a bad rap, I think, in some aspects of social media that I'm seeing that,
Mm.
they are a life-saving tool for so many
Oh, yeah.
women. And what I find is even if you're not able to come off it, maybe you explore a lower dose.
Yeah,
Because the problem with antidepressants, the true problem with antidepressants is the side effects, right? Like they
exactly.
are great for anxiety, they're great for depression, but they can lead to weight gain, they can lead to low libido. And at high doses, they can actually make night sweats worse as well. So it's like you're walking a tightrope. You want to get just the right dose to manage your
Yeah.
symptoms, but without those pesky side effects. So yeah, I'm so glad. And I actually find that with my patients as well is that once we've managed the root of their symptoms, they often go back to their doctor and say, listen, I know you started me on this because I had all of this depression and anxiety that started cropping up in my late 30s, early 40s, but I never had depression before that. Perhaps this was all connected to my menopause transition. And maybe now that I have I've addressed the root cause of those symptoms, perhaps I don't
Mhm.
need all of the other medications that I'm using. I think if we can manage perimenopause through really good foundational lifestyle approaches plus or minus hormone therapy, women could cut back dramatically on the other medications they've been taking.
Yeah, I mean, I see this. So the women that I work with are between ages like, late 30s to mid 60s. And so some of them are in menopause or even beyond it. But the primary ones that they're really looking at with their doctors are blood pressure medication after removing alcohol, and depressant and anti-anxiety type medication. Like those are the primary ones that they're like, I don't need these anymore. Like,
Absolutely.
so it really stems from like we are what we put in our bodies. Like, and when you start with exercise and diet, and that includes alcohol intake, like what you put in, it all adds
Absolutely.
up. Yeah.
And one thing we didn't even have a chance to really talk about when we did the podcast was let's talk about the actual universal health consequences of excessive alcohol use too. I mean,
Yeah.
the problem too is that midlife, both men and women, but it is more profound in women, our risk goes up for heart disease, including high blood pressure, heart attacks, strokes, heart failure, but it also goes up for cancer. And alcohol is a direct carcinogen. So it's always interesting to me that women that I see will go off to a specialist, they'll go off to the cardiologist, right? And then I'll see the note come back and it's like, we discussed whether she should actually be on hormone therapy because she has hypertension or whatnot, right? But they
Oh,
haven't addressed the fact that perhaps this patient's drinking excessive alcohol. And
yeah.
I'll say, well, did they say anything about your 2 glasses of wine every night? And they're like, no, she didn't talk about that at all. And it's like, I think we're missing the forest for the trees a little bit.
Yeah.
Alcohol is implicated in at least 7 different types of cancer,
Mhm.
like above the neck. It's a
Yeah.
direct carcinogen. It's a significant increased risk of tongue cancer, mouth cancer, esophageal cancer,
Yeah.
and those risks are significant for heavy drinkers. Um, but also breast cancer, colon
Stomach.
cancer, liver cancer, and it, of course, it's a dose dependent effect. The more you drink, the higher your risk. Fortunately, for many of those cancers, if you cut back, the risks drop with it, but not for all of them. Liver cancer, interestingly, doesn't seem to significantly reverse course even after you've stopped because unfortunately, it does take the brunt of that carcinogen and that cancer causing effect. So we can't ignore this when we talk to our doctors or when doctors talk to their patients. It's not an easy thing to bring up. It's not an easy thing to discuss.
Yeah, it's interesting that you also are pointing out that for reversing your risk or lowering your risk of cancer for the liver, because the liver is one of the most resilient organs we have too, like as far as it being able to repair itself. So that's, I find that one
I'm
scary.
not saying it can't. It's just it's once it I think it's once it reaches a critical threshold of damage, once
Yeah.
it's like fibrosed and scarred enough, it's
Mhm.
really hard for it to repair itself at that point. It can certainly repair itself in those early days, right?
Yeah.
But chronic heavy alcohol use, eventually the liver becomes really scarred. And anybody knows scar tissue. There's
Yeah.
no reversing scar tissue. Once it's completely lost its healthy cells and its healthy ability, its blood flow and the things that help it to return to normal health, there's not much that can be done about
Yeah.
it.
Yeah. One of the things that you said was we're not talking about this enough with like our doctors. And I know some of this is women are afraid to talk about this with their doctors. Everyone that I talk to and in my own experiences, we are big fat liars when it comes to telling our doctors how much we drink. And
Uh,
the it sucks, but that's really the reality. Nobody wants to write down that real number of how many drinks they have per week on the little entry sheet or pre-check-in sheet. And
it's true.
the women the like when whenever I have women who are like going on a checkup and they like cannot wait to go to the doctor and tell their doctor that they quit drinking, they're like, I'm not going to tell them how much I was drinking. I'm just so excited to like write zero next to number of drinks per week because
Right.
it was like it's just part of the double life and like the dirty little secret that women keep around how much they drink in the background.
And I think doctors don't always do a great job of, it's a lot of finger pointing, it's a lot of blaming, and it's a lot of blanket statements like you need to cut this out. Instead of
Yeah.
like, my approach is often, tell me why has it always been this amount for you? And tell me why, like what problem are you solving with it?
Mm.
Because I know they're not just doing it for kicks and giggles most of the time,
Yeah.
especially the women I'm seeing in at this place in their life is that they're doing it because it is solving that sleep problem, that mood problem, that stress problem, that anxiety, social anxiety. There was a study done in the UK. They did a survey. This wonderful menopause doctor, Louise Newson. Her clinic did a survey about alcohol use and drug use actually in women in perimenopause, and they asked women what are the reasons why you turn to alcohol, and managing anxiety, managing mood was number one by far.
Mm.
And part of it was social anxiety because if you start having brain fog and you start getting really nervous about being in situations where you have to speak to people or being at a gathering or something, and you already feel like you're losing your sense of self-confidence. Well, what's better for that? Liquid courage, right? It's like
Yeah.
let's dive into that. And that becomes something they lean on, but they're not, again, is because they're not being given the proper access to the proper tools that they need. What is it
Yeah.
that will actually help you sleep? What is it that will actually then resolve your brain fog? Could you have something? Brain fog feels a lot like ADHD.
Yeah, yeah. And a lot of women that I talk with, and I think this was kind of part of my life too, like we think for socializing, we just make a connection that alcohol has to play a role in that. And over time, I don't think we even realize that we don't actually maybe like the socializing and we're only drinking to tolerate it and to get through certain functions or whatever. And I wish that women knew that they are so much more interesting when they don't drink. Like you have so much to say and so much to offer. It doesn't really matter what you're drinking.
Yeah, I think that it's again, it's just so important to really not talk so much about the quantity, but let's focus on the reason. Because
Yeah.
I'll be honest, it doesn't matter if you're having 5 drinks a week or 10 drinks a week from my perspective, because I'm all about, we know no amount is safe.
Yeah.
That's not to say you can't have 0 to 2. That's in Canada, that's our guideline. 0 to 2 is considered low risk per week.
Yeah.
Low risk in terms of those cancer and heart disease and strokes and stuff. So I like that we've kind of put the new guidelines on a spectrum.
Hmm.
0 to 2 is low risk. How do we get you to low risk?
Yeah.
Most of the women I talk to are either low or moderate risk. And
Mm,
moderate is 3 to 6 servings of alcohol a week. And a serving is 5 ounces of wine, 1.5 ounces of spirits, or 12 ounces of beer or cooler.
yeah.
So 3 to 6 is moderate. And then 7 or more is high risk. And so by framing it that way, you say, well, listen, like most other things, we all choose how much we want to exercise or how much stress reduction we want to do or how we want to do our cancer screening because we're choosing our level of risk. Some people say, I'm going to
Yeah.
do all the cancer screening and I'm going to get everything done on time and I'm going to go for it. And I'm going to do as much as I can because they want their risk to be low of
Yeah.
developing a late stage cancer. Others say, oh, I'm not going to do any. I'll just take my chances, right? Okay, but chances
Yeah.
are then you're not going to find something until it's very symptomatic. So we can do the same with alcohol use as well. And so I think giving that option of, look, I'm not here to tell you how much to drink, but I'm just going to give you the facts. Like this is how you can be the lowest risk possible. And I always presume somebody is coming to a doctor because they are interested and invested
Yeah.
in being as low risk as possible for developing heart disease
Yeah.
and cancer. Those seem to
Yeah.
be the things people are quite fearful of, right? So
That's what I'm the most afraid of. Yeah.
I think it's human nature, right? Like we're so afraid. What we all run to the doctor if we feel we have chest pain.
Yeah.
That is hardwired into us. Like I don't want to miss a heart attack, um,
Yes.
right? Or a breast lump.
Hmm.
Every woman who's found a lump in her breast has run, not walked, to the doctor
Right.
to
Right.
get that checked because again we just have this primal fear of cancer, of breast cancer especially.
Yeah. Yeah. I'd say the third thing that I'm afraid of that keeps me up is having a stroke. I don't know.
Yeah,
Like, I worry about my cholesterol an unreasonable amount, even though it's perfectly fine. And I'm worried about I'm gonna like drop dead at 50 from stroke or a heart attack. That's what keeps me up at night.
yeah, it makes sense. I think those are the things because a heart attack and a stroke, we hear often about the survivor stories,
Hmm.
but the first symptom of a heart attack for 50% of people is death.
Yeah,
And
that's
so it's not a guarantee. It's not a guarantee that you survive a stroke, or if you do survive a stroke, do you survive with your baseline the way it was before?
right, right.
So if you um, accept those risks, fine. But if I'm not even telling you that you're increasing your risk of those things by drinking in excess of 7 drinks or more a week, I'm not doing you a service. I think you deserve to have that information. If
Yeah,
you decide you're willing to accept that risk, like every other risk, you may not wear a seatbelt. I'm not going to show up at your house and force you to put your seatbelt on.
yeah.
But my job is to tell you seatbelts dramatically decrease your risk of dying in a car accident.
Right, right. And if you are, drinking in the excess range, then your risk goes up. Like, I don't know. And I also find that, there was a time in my life where I did only drink 3 to 5 drinks a week, or maybe even two, I guess. But that it just kind of turns into a progression because it's so easily accessible and it gives you the quick relief that over a course of time, usually not very long, all of a sudden you realize like I'm like I used to say, gosh, I'm just a one trick pony for relieving my stress. Like it's my
Mm,
quickest path, and it just became this like every single day thing. And that's what happens. And then we're kind of like, oh my gosh, how did I get here?
yeah, I think that's a really common, and other women will say, well, yeah, I like to drink while I make dinner.
Yeah.
It's the ritual of it. But I'm sure, like I explain to patients as you do, you can change rituals. You can create a new ritual.
Yeah.
Because the thing about a ritual is it's just a thing you do every time that you associate with it's time to decompress. It's time for the day to be over. And there's lots of different ways that can be achieved. Not easy because there's, of course, the elephant in the room is the addiction
Yeah. Yeah.
potential.
Yeah. So going back to the menopause and
Mm,
perimenopause piece,
mhm.
so we already know you've shared about like the effects of alcohol and kind of like exasperating the symptoms, but
Yeah.
what's like the first piece of guidance that you give your patients who are starting to have these symptoms? In addition to, I know you also prescribe HRT.
Yeah. So
Oh, you cut out.
apart from dealing with any vasomotor symptoms, like hot flashes and night sweats and managing that, we have to deal with sleep.
Mm.
Sleep is always the thing. I'm not gonna say always, 90% of my patients notice that sleep disruption is
Yeah.
one of the primary first symptoms that comes up. So we have to discover what is it exactly that's disrupting your sleep. And for some, it might be excessive
Mhm.
alcohol. Um, but even in the absence of that, are they having restless leg syndrome? Do they have sleep apnea? Are they just waking up because their brain is tired, wired? Do they have depression or anxiety that's causing them to wake up early and just ruminate, just dwell on everything that's making them sad or anxious? And
Yes.
sometimes it's like a puzzle. It doesn't have to be one thing. It can be a combination of factors. And I think by solving the sleep problem and getting to the root of the sleep problem, we then have this trickle down effect of better mood, better coping mechanisms, less cravings for sugar and salt and fatty foods and quick
Yeah.
hits of sugar. We have
Yeah.
greater energy expenditure. So you're working out more, you're moving your body more, and you're more productive during the day. So you can give yourself permission to sleep at night. And it's a beautiful cycle that starts to happen when women realize they need to prioritize that sleep.
Yeah, yeah. I mean, I could not agree more. That was the one of the first things that I noticed when I quit
Yeah.
drinking was just around like falling asleep and waking up naturally, like without needing an alarm. And just my overall sleep hygiene started to improve because when I removed alcohol specifically, I also just like I stopped watching TV so late at night and I stopped scrolling my phone. I would read in bed instead of like, whatever, like staying up too late, and more consistency around going to bed around the same time every night, and just like all the things, no sugar, no caffeine after like, 1 o'clock or whatever, two
Yeah.
o'clock. And it's just amazing how it plays such a role, and your ability to carry more stress and manage more stress.
Yes, the disinhibition. Once that's gone from your, like, once you can erase that from your life, suddenly you're doing more. You're feeling better about yourself. It's always hard when you're in it. And I see this, it's not just with alcohol now, it's also with cannabis. Like since it was legalized here, It's on every corner. I'm seeing more people lean into cannabis the way that they lean into alcohol. And in a lot of ways, it's replaced it. People
Yeah.
think, well, I don't want to drink anymore, but I'll just use cannabis instead. It has the same depressant properties. It has the same impact on your sleep architecture. You may
Mm.
feel like you fall asleep easily. You don't have a good quality of sleep. And it's the good quality of sleep that determines then how we feel the next day. You
Yes.
you can't get 6 hours of shallow sleep and feel the same. You're better off getting 5 hours of good quality sleep. Um, but it's a facade.
Yeah, it's actually really interesting that you say that because there are, I can probably count on one hand how many like bad nights of sleep I've had since I quit drinking. But in those times where it is only like maybe 5 or 6 hours because of, having to catch an early flight or something along those lines, it's like I still feel okay throughout the
Mm,
day. And like I can function because it's different than interrupted sleep from alcohol, or like maybe I got two REM cycles instead of however many I normally get, but at least they weren't interrupted. So it's
yeah.
totally different.
How I'm gonna ask you a question though, like how many days did it take you to start to feel different?
Yeah. So it was like around the 2 week time period. And I took several short breaks from drinking before I finally quit drinking for good. But it was really like around the 2 week time period where I started to sleep better and started to just feel better. And then it was the 45-day mark where it was like my whole body chemistry changed.
Mm,
Like, as far as like falling asleep, popping out of bed in the morning without my alarm, and the mental fog totally gone. Like my energy was just through the roof. And it was pretty unbelievable, honestly.
but it's interesting because it took a while, like 45 days, two
Hmm.
weeks, 45 days. We're not used to that now as a society. Everything is about instant gratification. And I'll speak to women who say, I did dry January and I didn't lose a pound and I didn't feel different. And I'm like, but if you've been drinking X amount, if you've been drinking in excess for years or even decades, 1 month is not enough time for your brain and your body to even trust that this is going to be the new normal.
Yeah, I mean, it takes like 3 to 6 months to start to really feel safer without it. And really, it's
Mm,
like it was probably around a year where I started to think like, oh yeah, I'm not going to drink anymore, like ever again. Like I don't. And up until then, I was really unsure, like what is my life going to look like without alcohol in it? And I would also say that it's it's around 4 to 6 weeks for your metabolism to normalize, because you're not metabolizing alcohol all the time. So
right.
it's very common to not lose weight until after, 6 or even 8 weeks, because also you develop quite the sweet tooth. Even if you don't have a sweet tooth, you're
Yes.
really craving that sugar. And so it's like, maybe you're not drinking, 300 to 1,000 calories of alcohol a day, but are you like, I replaced it with something else.
That's the thing is that it has its own downstream effects, right?
Yeah.
Drinking has its downstream effects. So just because you've taken your foot off the brake by stopping it, it's a whole other thing to step on the gas and move
Yeah.
that car forward. So all you're not only undoing the damage that the alcohol has done to your body over those months or years, you're then it takes a lot longer to undo the metabolic harm that you've done by the altered way you're eating or the
Yeah.
time shift of when you're eating in the day, because if you're drinking in the evening you're probably eating later than you would otherwise. not moving as much,
Oh, so many
right?
failed workouts.
Not
Yeah.
sleeping as well. So
Yeah.
it's about having enough time then to move forward with your new lifestyle. It's one thing to
Mhm.
break that habit. It's another thing to reinvent yourself as a non-drinker, as an abstainer.
Yeah, exactly. And, earlier you mentioned like we want that instant gratification. And this is, I subscribe to Atomic Habits and that book. And he talks about how the reason why our healthy habits are so hard to keep and maintain are because they don't give us instant gratification. That's why we go back to the bad habits because we
Mhm.
want that instant gratification. So if you quit drinking and you've adopted this new lifestyle and you're developing these new patterns and rituals in your life, it might take 3 months before you feel better or notice a difference. And that we don't like that.
We
We
don't like
want,
that. No, look at even the weight loss medications now. You see a celebrity and a month later they've lost 40 pounds. It's like that's okay, that's what we're doing now.
yeah,
And
yeah,
I always tease my girls. I'm like, you guys would never have been able to live in the 80s or the
no,
90s. We had to rewind a tape to watch the show again. Can you imagine? We had to wait a week for the next episode of the show to come out,
yeah, yeah,
right?
exactly.
Where was it like I can binge a show? It wasn't, this instant, I want it, I want it, I want it now. We're in a way, we're in a very privileged time where we're able to do things quickly. We're able to consume things at a rate that resolves this like need for dopamine that we have.
Yeah,
But real change takes time.
it does.
It
It
still
does.
takes time. You can't binge watch your way to weight loss. True metabolic weight loss takes time.
Exactly, exactly. And it's like the boring, basic daily habits are the best ones for us, I think.
I think that's why I don't have the biggest Instagram or anything. It's because you know what? The truth and the things that really work are not as sexy. They don't sell well.
It's so,
It's a little boring, but in the end, I think it wins. It
yeah.
always wins because everybody does come to that conclusion sooner or later,
Hmm.
or they'll they'll become frustrated trying for the quick fixes.
Yeah, exactly. And the quick fixes usually are not sustainable either. You're right back where you were a few months later or a year
Yeah.
later. So, oh my gosh, we've been talking
I
over
know
30
it's been a half
minutes.
hour. Well, listen,
So,
we're going to be, people can hear us talk. We'll post this. We'll post this for
yep.
people to watch it if they were busy at work and they want to hear us chatting about this. But I'm really looking forward to hearing the episode on Wednesday. It's going to be really fun.
Yes, so a new episode, Feel Good Alcohol Free, comes out Wednesday, and I am interviewing Dr. Jen Zalobitsky.
Yeah.
Yes!
Yay. Well,
And
well done.
yay, thank you. And we can continue the conversation over there. So thanks for watching, everyone.
Thanks, everyone. Have a great day.
Bye.
Bye.